Hello, my name is Katrina. I'm going to be your family nurse practitioner student today. Can you tell me your name and the reason for the visits today?
My name is Odetta Sita-All, and I am here for my annual physical.
Okay. Your overall state of health appears well. We're going to begin with the eye exam. So your sclera is white, conjunctiva is pink, your pupils and irises bilaterally are round. Irises are brown in nature and pupils are black. We're going to be taking a look at pupil accommodation to light, so just look straight ahead for me. So on the left side, pupil goes from 5 millimeters to 3 millimeters, and on the left, 5 millimeters to 3 millimeters. Next, millimeters. Next, we're going to be doing the ocular motor exam, so you're going to follow my pen light. And then we're going to be doing convergence and accommodation test, so follow my pen light to your nose. And then look at me, look at my pen light, and look behind my shoulder. Look at my pen light, behind my shoulder. Appropriate convergence and accommodation. I'm going to be looking at red light reflex, your optic nerve, fundus, and vessels. Red light reflex present, optic nerve, vessels, and fundus are intact. And then on the other side, red light reflex present, fundus, optic nerve, and vessels are intact. So we are done with that portion of the exam. Let me switch over to the next portion. We're going to be looking at your head first. I'm just going to be palpating and inspecting your hair. Upon palpation, your head appears normal cephalic atraumatic. There's no hair loss noted on this side. One nevi noted, brown appropriate borders, and symmetrical in nature. So nothing I'm worried about. No infestations. Hair color is brown, soft, and thick in nature. We are going to be moving on. I'm just going to be taking a wisp of cotton and just let me know if you can feel it. So look straight ahead. And let me know.
Yep.
And then I'm going to have you do a big smile, puff out your cheeks, raise your eyebrows. Wonderful. So we're going to move on to the nose portion of the exam. So your nose appears midline. First I'm going to do a smell test. Cover one nostril. Tell me what this smells like.
Rubbing alcohol.
And then the other side.
Fruity.
And then I'm going to be taking a look inside of your nose. Might feel a little tickle. So no nasal polyps noted. Your septum appears midline. And then mucosa is pink and intact on both sides. So we're going to move on to the ear part of the exam. I do just have to do a couple of testing, so I'm going to repeat it. I'm going to say a couple of words, and you just repeat them back to me, okay?
Green car. White post.
I'm going to be looking inside your ears now. Any hearing problems that you know of?
No.
I'm going to have to sit on the exam table to get an appropriate level. Okay, tympanic membrane on this side is gray and intact, and I'm pulling the aura back. And tympanic membrane on this side is also gray and intact. No lesions or polyps noted in the ears. A little bit of earwax. We're going to move on to your lips. So your lips appear pink in color. There no dryness, scaliness, or flakiness noted. I'm going to have you open up your mouth and say ah. Stick out your tongue for me a little bit. Okay, tonsils are there, but they're a +1 grading. Uvula is moving appropriately. Your pharynx and hard palate are intact. Next, I'm going to have you stick out your tongue and just move it side to side. And that cranial nerve is intact. I'm going to palpate your lymph nodes now. So we've got preauricular, postauricular, occipital, submandibular, submental, deep cervical chain, cervical chain and deep cervical chain. No lymph nodes are worrisome. I'm going to have you shrug your shoulders and move your head side to side. Okay. And that cranial nerve is intact as well. So for the next portion of the exam, it's going to be the lung exam. I'm going to have you sit down. First, I'm just going to be looking at your chest overall. just looking overall, your anterior to posterior ratio is 2 to 1, which is appropriate. And then I'm going to be palpating your chest and just feeling the expansion. Any pain anywhere? Okay. And then go ahead and take a deep breath in and out. So we've got appropriate expansion there. My thumbs move appropriately. Next we're going to be doing the tactile from a disc test. So I'm going to have you say 99.
99, 99, 99, 99.
Wonderful. I will be auscultating now with my stethoscope, so you're just going to take deep breaths in and out.
Okay.
Deep breath in. I do have to percuss your back for a CBA, so you're just going to feel me percussing your back. Let me know if there's any tenderness noted. Nothing worrisome on percussion. Next, I do have to listen for adventitious breath sounds, so I'm going to first just listen with my stethoscope right here, and then I will have you say E, E, okay? Okay, go ahead and say E.
E,
And again.
E.
Good. So overall, your lung exam appears within normal limits. For the cardiac exam, I'm going to have you sit up here. I just have to palpate your chest to begin the cardiac exam. I'm palpating for thrills, heaves, none of that noted. Any pain or tenderness?
No.
Okay. I will be auscultating the the heart sounds, so you can just sit normal. No murmurs, quality of pitch is normal. Noting that S1 sounds are greater at the apex, S2 sounds are greater at the base. Overall, I'm just going to auscultate for your apical pulse, so I'm just going to listen to your heart and time it. So normally for the exam we would do 1 minute, but to save time, I'm just going to do 15 seconds. So your heart rate is about 70 right now. I'm going to palpate for the point of maximum impulse, which is right here. It's about quarter sized. And now I'm going to feel your pulses. So just have to feel your brachial pulse bilaterally at the same time. Carotid pulses one by one. Radial, posterior tibial, posterior tibial right here, and then pedal pulses. Noting +2 pulses in all extremities. We are going to move on to the abdominal portion of the exam. I'm going to have you lay back. So first, for the abdominal portion, I'm going to begin with auscultation and then palpation. I'm not sure if I said this, but no bounding pulses noted. Pulses were 2+ bilaterally throughout the body. Normal active bowel sounds heard in all 4 quadrants. I'm going to start with light palpation and then move on to deep palpation. Let me know if there's any tenderness. do have to go back and auscultate your arteries, so I'm just going to be doing that now. So abdominal artery, renal artery, and the iliac. No worries noted there. Just going to be doing a couple of special tests. So first we're just going to check for cholecystitis, so I'm just going to push down. Let me know if there's any, take a deep breath in, and I'm pushing down, let me know if there's any tenderness noted with that.
No.
And just feeling around the borders of the liver, not noting any masses or swelling, liver appears normal, and then just feeling for the spleen, and then unable to palpate that, which is a normal finding. Next we're going to be moving on to some appendicitis signs, so from your umbilicus down to here. Let me know if you have any pain when I push up.
No.
Okay, and then I'm going to push down and let me know if you have any pain at all with this test.
No.
Okay, so that concludes the abdominal portion of the exam. So we can go ahead and stand up. And then I don't know if I said earlier, but normal active bowel sounds heard. So I just need you to walk for me. Arms are swinging appropriately. And then I need you to walk on your toes for me. And then you can walk back on your heels. And then you're going to do toe to heel walk, just to the other side. Okay, and then I'm going to have you stand up, close your eyes, and just lift both arms out. And we're doing this for 20 seconds. Okay, you can put your arms down. That wasn't quite 20 seconds, but it the test was normal. So now I'm going to have to do some musculoskeletal testing. So first we're going to, you can sit down, and we're going to do the head movements. So you're going to do head flexion, head extension, lateral, cervical rotation. So it's cervical flexion, cervical extension, cervical rotation to the left, cervical rotation to the right, and then cervical side to side. So flexion, extension, cervical rotation to the left, cervical rotation to the right, and then cervical to the left and right. Wonderful. And now you're going to be doing spine movements. So you're going to stand up. So you're going to be doing flexion, extension, and then lateral movements again, and then I just need a rotation. You can start with whatever. Flexion, extension, lateral side to side, and then rotation. And then we're going to be doing shoulder movements. So you're going to be doing flexion, extension, and then abduction, abduction. And you're going to swing your arms out, and you're going to do a lateral rotation in, and then an external rotation bilaterally. Okay, but you can do them one at a time. So flexion, extension back, adduction, abduction. Go ahead and move over so you can do the other side. Adduction, abduction, and then, yep. On the other side. Good. So now we just will have you lay back. And then, so we need hip movements. So I'm just going to take your leg and lift it up. And we're moving out and in. And then the other one out, in. And then you're able to lift up and down. Sorry about hitting your leg. Up and down. And then just, I want to make sure. Abduction, abduction. On the other side. We don't have much room. Go ahead and lift the knee. Okay, so flexion, extension, or extension. Flexion, extension. Other side, flexion, extension. And now I'm just going to be palpating for your ACL, MCL, LCL, and PCL. ankle movements we tested with the with your walking. So you can sit down for me, and we're going to be doing deep tendon reflexes. So I have to do brachial reflex and radial reflex. And other side. Reflex. And then patellar, just go ahead and squeeze out. And then for your Achilles. Okay, so all your reflexes up here intact. Overall, your examination went